In this video, we're walking through a diabetes care plan so that you can ace your care plan for nursing school. Let's do it. So if you're a NursingSOS member, be sure to check out the type 2 diabetes study guide that we have for you inside the NursingSOS membership community, because I am actually going through it as I walk through this care plan with you. So if you want to see where I'm pulling this information from and kind of follow along that way, definitely check it out in your member dashboard. So the first part of any nursing care plan that you write is the nursing diagnosis. And the nursing diagnosis has 3 parts. The first part is the NANDA approved nursing diagnosis. Now, this is standardized. This is such good news for you because you don't actually have to create it yourself. They just make them for you and you just have to pull from a list. So some ones that you might want to use for a patient with type 2 diabetes are possibly risk for infection, risk for injury, risk for impaired skin integrity. There's a lot of others, but those are really 3 key ones that you could use for type 2 diabetes. If you want more help with how to write a nursing diagnosis, be sure to check out this video here. I walk you through exactly how to do it. It's so helpful. And then the second part to writing your nursing diagnosis is the related to factor. Now, here's where so many nursing students just really get things wrong in their care plan. I'm trying to say that in a nice way, is here, right here in this related to section. This is where a lot of nursing students miss points. This related to section is the pathophysiology. So I really want you to dig deep and think about what is actually happening with the patient with whatever disorder that they have that you are trying to address in their care plan. So what is the pathophysiology behind what is going on with them, okay? So here in type 2 diabetes, what is happening in diabetes? That's really what you want to be thinking about. What is happening with this disorder? So here the cells in the body stop responding to the insulin that is being produced. This is called insulin resistance, right? Then the cells aren't able to use that insulin. And so the pancreas just stops creating as much of it. And that causes even more hyperglycemia. So the patient ultimately just has hyperglycemia, higher blood glucose level. So this is the pathophysiology of what's actually happening inside the patient's body. Now, this is really where you're going to impress your instructor with your nursing school care plan, because you really want to show them that you actually know what is happening with your patient. And here in that related to factor is a fabulous place to do it. Now, the third part of your nursing diagnosis is the as evidenced by. This is basically just signs and symptoms. What are the signs and symptoms that you saw with your patient that give evidence for your nursing diagnosis? Now, the second column to your nursing school care plan is the patient goals. Now, here in this column, you'll start all of these out with the patient will. This is patient centric. What goals do we want the patient to achieve in order to, help improve that nursing diagnosis? So here for a patient with diabetes, we could say things like the patient will have a regular breathing pattern. The patient will have a stable blood glucose level. You might want to put a number to that too. So if they started with a blood glucose of 150, you could say the patient will have a blood glucose level of 110. Whatever would be appropriate for your patient, right? The patient will have no urine ketones. That would be a good one. So in this column here, you would put the patient will. Now in the next column is all about you as the nurse or the nursing student, right? The nursing interventions. Now this column is what you will do as the nursing student to help your patient meet their patient goals. So some really great nursing interventions that you could do: blood glucose monitoring, of course, frequent monitoring of urine ketones or lab values, educating your patient on how to manage their type 2 diabetes at home, right? Or how do they administer insulin if they need it, or anti-diabetic medications if they are prescribed those things, diet and exercise changes or modifications, right? So in this column, you will write all of those as the nurse will. So the nurse will educate the patient on lifestyle modifications. The nurse will assess lab values every 4 hours. The nurse will monitor the patient's blood glucose level. So in this column, it's all about you and your nursing interventions and what you will do as the nurse in order to help your patient meet their patient goals. And now the final column, the evaluation column, is all about a reassessment of how your care plan went. Did your patient meet their goals? or not. If they did meet their goal, fantastic. You don't have to do anything else. They met their goals. Everything is all fine and dandy. But if they didn't meet their goal, then in this column, you would want to write why they didn't meet their goal and what you will do differently next time in the next care plan in order to help them reach their goal. And like I said earlier, if you are struggling with writing the nursing diagnosis, that's really oftentimes the trickiest part of this whole process. You definitely want to check out this video here, and I will walk you through how to write an amazing nursing diagnosis and go become the nurse that God created only you to be. And I'll see you over there in that video. Take care. Bye-bye.